candidate, MacLeitch, sorry, is the founder and CEO of Logo QuickBlox.
QuickBlox, yeah. So, yeah, it's always kind of dangerous to be the last person between food and alcohol, so I'll try and keep it reasonably short and kind of go through from there. I used my computer because I had a little demo which I was going to kind of show at the end of the presentation as well. But basically, QuickBlox, what we do is we have a lot of good talks earlier today where Holly talked about Clinic of the Future and Ashish talked about using safe and compliant GPT for providers. We're actually building a number of those tools so that clinics and health tech organizations can actually bring that into their own organization. So we provide communication and AI tools through a backend, which allows people to integrate these tools through SDKs, APIs, and kind of technical integrations. But on top of that, we've got a variety of different kind of ready applications, like a plug-in chatbot or AI assistant, which can be HIPAA compliant, and also a white label telemedicine solution. So why are we building these tools? I think everyone knows the problems in terms of how do we make healthcare workflows more efficient, how do we make it to be patient-friendly, how do we make tools that improve the providers and their admin staff's lives. So that's basically our mission, is to create a variety of communication and AI tools to improve kind of the whole healthcare process through technology. So what's the problems? I mean, I think they've been talked about all day, but I'll keep it pretty short. But obviously there's a lot of disjointed communication. You know, a lot of EHRs don't talk to each other. A lot of the ways that people engage through different tools or through different systems are oftentimes disconnected. And so there's a real fragmentation in the healthcare system. So how do you get the ability for users to communicate seamlessly through a variety of different environments? And we're a strong believer in the power of AI to be able to solve those problems, because AI can interact with you in a multimodal way through voice, video, or messaging, and it can also keep history and kind of provide the context. So depending on where the user is and who they're interacting with, AI can serve a lot of that. Healthcare also has a severe administrative overload, from anything from basic scheduling to creating your soap notes or creating your after patient visit summaries, doing intake, doing follow-up. There's just a tremendous amount of administrative burden. And so this is also another tool that AI is really great at doing, where it can basically automate and pull in information from a variety of different forms for intake and for different areas. And then also, I think Ashish kind of hit this one, but access to AI tools, and you want to make sure they're safe and compliant. There's no leakage of PHI of the patient into other environments. So from that point of view, you need to make sure that those AI needs are also accommodated. So our the pain points, 80% of providers mention lack of efficient communication, 49% of time spent on administrative tasks, 25%, 27 appointments missed. And so if you actually talk to people who are dealing with things, manual data entry is something that obviously we'd like to get beyond. If you're in a world where people can speak into an AI and gather that information, or interact with an AI assistant, which can do that for you. You also want to have a consolidated communication layer. So if you switch between multiple platforms, I think you were the one who had the different stickers of all the different apps and different solutions. There's kind of a lack of consolidated glue in healthcare today. So if you can create a communication layer that enables kind of seamless interaction, movement data, then you're kind of winning there. And then how do you kind of keep the people on time with the scheduling? So what our solution actually does to bring it down into practicality is that we provide a HIPAA compliant AI assistant. We have both a low-code version where a provider or an admin staff can go on our back-end platform, don't need to know how to code. They can upload a knowledge base. That knowledge base is contained within a dedicated RAG with guardrails. So then you can create bots that can ask questions, do intake, and interact with that end user. It can also be targeted for different industry verticals. We then have tied that into a white label video consultation, video collaboration platform called QConsultation that allows your ability to do actually the virtual visit. And within that, we've tied in a number of AI tools where you have intake and summarization and creation of SOAP notes and ICD-10 codes. And then on the back end, I know this is more of an MD room, but We have APIs where that data can be pushed over to other third-party systems. And then finally, we've got kind of the toolkits to actually build this stuff. So you can actually take the components or the modules and put them within your own website application. So our product covers a variety of different use cases, from a clinic wanting to interact with a chatbot, to a white label telemedicine solution, to kind of a whole communication framework for communication. So our platform's pretty comprehensive, so we can glue other systems together through SDKs and APIs. We enable technical people to integrate our tools within their applications or websites, but we also have some low-code, no-code tools that physicians and providers and admin staff can use without having to know how to effectively code, right? You want to create your own knowledge agent and your own bot, you can do that in our system very easily. We've got a reliable back-end platform. Teledoc uses our platform for messaging. We have a number of other kind of major brands that use kind of the information and communication infrastructure. And then we've leveraged kind of the AI revolution to add a variety of different capabilities to do like intake through AI, triage, and then the most important thing I think that oftentimes gets missed in this AI revolution is how do you bring the human in the loop? And so our tools are intimately designed to enable to have human handoffs for creation of AI-powered coaching use cases, telemedicine use cases, or other kind of virtual collaborations. So if we take a look at kind of the type of customers that we serve other technology companies. So if they're doing health tech or creating healthcare related platforms, you can use our infrastructure rather than build a lot of these tools yourselves. We serve a lot of startups who might want to create their own chatbot or their own agent in a HIPAA compliant way. We also are increasingly serving more healthcare customers, so especially clinics that might have an intake process they want to automate through AI, or have certain questions asked, so kind of tie it into your comments around the clinic of the future. Mental health, we have customers today using it for doing counseling and a variety of kind of use cases around there. And then chronic disease management, another of our customers is in the organ transplant management platform, and they're using our chat to enable the healthcare navigators to communicate with the end patients, and then private practices and clinics. So we kind of sit at the intersection between telehealth and AI and healthcare, which those are obviously very large growing markets, and we're providing kind of some glue and infrastructure as well as ready apps to kind of service those markets. So we're done as SaaS, so if we work with companies and they want to create an AI agent, we allow them to get that bot through like a SaaS license and just pay a monthly recurring fee, or the same thing with the telehealth. Our pricing is free to paid, so you can basically log in for one of our platform models. And then really our target audience is healthcare, health tech, and other regulated industries. We're SOC 2 compliant, HIPAA compliant, we issue BAs, so all those kind of fun stuff that you have to do if you deal with any kind of health system, clinic, or interact anyway with patient data. And and then we've got some easy bot plugins and white label video consultation. So if I was to kind of talk about some customer use cases, CareDx, their organ transplant management platform, as I mentioned, they're using it to connect patients with care navigators to secure chat. We have, I'm going to show a demo later with one of our customers who's partnering with schools and sports clubs to enable AI-powered consultation around sports injuries and sports management, and then kind of communication around teledoc. So basically, if you were to put us in a little box, we've got kind of white label telehealth, white label HIPAA compliant AI systems in a platform which you can customize to your own organization. So if my demo works, then I can kind of show you an example. This isn't obviously with PHI, but on the right hand side, you have an application where a user's kind of logging in to an intake where they can basically report an injury. So all this information is basically being gathered through a form. We also have an input where the AI bot can ask a variety of different questions, where that can be programmatically done. So whatever kind of intake questions you need to do. So in this case, it's a sports injury, asking the details of it, and then obviously you can upload files or details there. Once that information is done, that's created a summary both for the provider admin staff and for the patient and end user themselves. And then that message is sent to an AI assistant, which can then take that intake information, run it through a knowledge base, and then come back with a recommendation to say, okay, hey, in this case, it's just giving like the RICE protocol until they get connected to an actual provider who can provide real support. So in this case, at the bottom, there's the ability to basically connect to a human. So in this case, what happened is it's gone into our telemedicine platform. You got the ability to kind of look at the patient information if it's captured earlier, the description of the information that's coming there, the chat, and then I click on the tab, the history of all prior engagements. And so within the chat itself, the provider can see what the AI is communicated with. They can pull information out of that, and then they can interact directly with the end user. So in this case, they're asking for triage information about what looks like an injury around a potential muscle strain or tendon. And so in this case, they also have the ability to have AI kind of rewrite their messages in a way that makes it easier to understand. So if they're not, the best at English, or if they're in a rush, it can create full sentences. And then there's the ability to do live interactions, and then they have their own knowledge base where they can basically check their own internal assistant, which isn't accessible to the end user or the end user, to basically ask questions about what that condition or disease might be. So if you have internal policies, you have your own data sources that you need to map the AI system to, can kind of give you some information, which then you can use to basically manage that interaction with the end user. And then basically, based on that virtual visit, they can then also, if they need to escalate it, I don't have it on this video, but they can escalate that to a video call. So they could do a live or asynchronous visit, have that scheduled. And on the back of that, we're also doing transcription, summarization, and creating SOAP notes and ICD-10 and CPD codes. So basically what we have here is a complete kind of AI communication workflow, which enables anything from the first interactions with the patient or end user all the way through to the virtual visit. Yeah, and that's kind of at a high level what we do as an organization. So I don't know if anyone has any questions, but that's it.
I see slowly the room is moving that side. So that's a good sign. Any questions?
So you're specifically integrated with Teladoc to provide those virtual visits? Or
So
could it be
Teledoc's actually using our software to do the messaging layer. So they've integrated our functionality into their application. But other customers might take some of our ready solutions and use them, in place. So that's kind of the platform layer. But then for this example here, which is kind of dummy patient data, the customer is an MSK clinic, and they have an app which they're called Sideline Ortho, which they're partnering with schools and sports clubs to create an ability to kind of AI triage basically patients or athletes, and then connect them with a trainer on demand effectively. So kind of tying that workflow between identification and human handoff. So a lot of coaching, healthcare related use cases are very common with our product, where people might want to have health navigators or coaches that come in there. Could be menopause coaching, which we've had before in the past. Could just be, FAQs or a variety of different questions, telemedicine, or, basically building out as part of your infrastructure. So in terms of what I guess we're looking for out of here, we'd love to chat with more physician innovators about our products, explore your use cases, see how we work together, get advice about how we can allow and enable our workflows to kind of accommodate different use cases, and meet some partners who may be relevant for what we're doing. So that might be Ashish in terms of what you're doing, and Holly in terms of what you want to do in the clinic in the future. So yeah, I'd welcome any other questions or comments.
Any questions?
Okay, I guess
All
time
right.
for alcohol.
Thank you very much. All right.